Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring information from integrative health experts throughout the world. Health is what you make it. I am Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Thomas Levy. Dr. Levy is a board-certified cardiologist and a bar-certified attorney. After practicing adult cardiology for 15 years, he began to research the enormous toxicity associated with much dental work, as well as the pronounced ability of properly administered vitamin C to neutralize this toxicity. He has now written 11 books, with several addressing the wide-range properties of vitamin C in neutralizing all toxins and resolving most infections, as well as its vital role in the effective treatment of heart disease and cancer. Others address the important roles of dental toxicity and nutrition in disease and health. Recently inducted into the Orthomolecular Medicine Hall of Fame, Dr. Levy continues to research the impact of the orthomolecular application of vitamin C and antioxidants on chronic degenerative diseases. His ongoing research involves documenting that all diseases are different forms and degrees of focal scurvy arising from increased oxidative stress, especially intracellularly, and that they all benefit from protocols that optimize the antioxidant levels in the body. He regularly gives lectures on his information at medical conferences around the world. His 11th book, Hidden Epidemic, Silent Oral Infections Cause Most Heart Attacks and Breast Cancer, was published in September of 2017. Thank you so much, Dr. Levy, for being on the show with us today. Your book, Hidden Epidemic, Silent Oral Infections Cause Most Heart Attacks and Breast Cancer. That is a pretty bold statement. What inspired you to write this book?
Well, that's a very interesting question because I guess about a year and a half ago, in January, I was with a friend at the dentist, and she was getting some root canals extracted. And in the course of, mapping out the surgery, they did what's called a three-dimensional cone beam examination of her mouth, called a 3D X-ray. And I hadn't worked much with that or seen much of that, but when her X-ray went up on the monitor, I could see from across the room that she had an enormously, grossly abscessed tooth, completely eroding away the bony floor of the sinus, with the sinus being largely filled with mucus and other infection. And I asked her, does that tooth hurt? She said, no, it feels fine. I said, you're certain about that? You can chew on that and that side, you never have any pain there. She says, no, it feels fine. Well, I knew that whether it felt fine or not, it was grossly abscessed and it had to be extracted too. And she did proceed to get that extracted as well. But then it occurred to me, well, how common is it to have a grossly infected tooth that doesn't hurt, but undoubtedly is pumping toxins and pathogens into your body every time you chew on it, just as with a root canal infected tooth? And when I did the research, I went home, hit PubMed, and started poring over it. I found that there's an enormous amount. And in fact, even though most of my dentist colleagues didn't seem to realize it, as I didn't, it turns out that a grossly infected tooth being asymptomatic, completely pain-free, is the rule rather than the exception. In fact, probably well over 97, 98, 99% of infected teeth are asymptomatic. And so I then looked at the research studies that looked at this type of tooth, which is called chronic apical periodontitis, something that shows up radiologically as being infected but not being painful, is extraordinarily common.
I'm just curious. So with this, you said you did a 3D X-ray versus a normal X-ray. I mean, what is the difference between the two? Because most people just get an X-ray and the dentist say, well, all your teeth look fine, and then off they go. So that is not enough?
No, and that in a nutshell was the whole point of the book, is that regular X-ray, regular 2D Panorex X-rays of the mouth miss these infected teeth roughly 50% of the time. But when you do the 3D exam, you rarely miss it, and you pick up all the other infected teeth. So it told me immediately that when people are just getting these routine X-rays and not getting additional examination, the most significant reason for their disease, their heart disease, their cancer, their arthritis, you name it, was being missed. And all they were getting treated for was symptoms rather than the etiology of the disease. So the point of the book is all physical examinations, in my opinion, based on the evidence in the book, should include this examination. In the same way that you get a glucose level. How do you possibly know that somebody's diabetic if you don't check their glucose? Answer, you don't. How does somebody know that you have a tooth that's grossly infected, that can't be seen on a regular X-ray, and is pain-free, not indicating any symptoms at all, if you don't deliberately look for it? Answer is you can't, and you don't. So any physical examination, even in the little kids, let's say you have a child with leukemia, there's an excellent chance that there's oral infections, infected teeth, infected gums in the mouth of that child. And if you don't identify that infected tooth, you're truly missing the one real chance you have to resolve that leukemia.
So you've actually been able to tie these hidden infections that people don't even feel, they can't even see on a normal X-ray, and tie that to heart attacks, cardiovascular disease, and cancers, things that are killing people right and left, and it's just draining our economy here in the United States and in most developed countries.
Well, that's true. And perhaps one of the most amazing things to me about heart attacks and oral infections, and I am a cardiologist, is that there's an enormous amount of evidence. Matter of fact, there's one study in which they looked at 38 patients who had coronary artery disease with plaques partially obstructing the coronary arteries, and they went in there with an atherectomy, sort of a cardiovascular roto-rooter, and they physically scraped out the plaque specimens from each of these 38 patients and examined them microbiologically for pathogens. Well, they found pathogens characteristic of oral sources in 38 out of 38 of these patients.
That's amazing.
And that's what I call 100%.
Yeah, absolutely.
The point is cardiologists recognize that inflammation always starts coronary artery disease, but for some reason they don't ask what's causing the inflammation. Because take my word for it, you don't spontaneously inflame your coronary artery. You only inflame it when you deplete your antioxidant stores in the artery, of vitamin C and other things, and when it's depleted, in comes the inflammatory cells, and what depletes it is the colonization of these oral pathogens inside the coronary artery. Almost 100% of the time. I would be very surprised to ever see a coronary artery disease patient if you're able to examine the artery and find that it's still a sterile, uninfected, uncolonized artery.
And here I thought heart disease was due to a statin deficiency. That's not the case?
Well, the thing about all the other risk factors is I'm not going to say risk factors aren't important. They are. But their importance is in propagating and promoting the evolution of the plaque and the plaque growth. They're not really important at all in the initiation of the process of atherosclerosis. That, once again, goes to the initiation of inflammation by pathogens coming from tonsils, gums, and infected teeth, root canals, and chronic apical periodontitis, entering the venous system and eventually reaching the heart. So that, things like high blood pressure, they're very important. I mean, you have uncontrolled high blood pressure, whatever coronary disease you have is going to evolve more quickly. But as far as the cholesterol agents, all these sort of things, they're not really that important. And as I can tell you know very well, there's a lot of side effects with those drugs.
Absolutely. And I'll look upon cholesterol kind of like the blaming that for heart disease. It's kind of like blaming the fireman for the fire. Just because he happens to be around where the fire is on a consistent basis, does that mean that the fireman is causing the fire? And
right. It's the basic difference between an association and correlation and a cause and effect. The two are always there together, as you mentioned, but it doesn't mean one causes the other. And this, I might add, was one of the reasons why this one study I'm going to tell you about was so profoundly significant is they actually, in 2013, in Finland, had cardiologists suck out the blood clots causing acute heart attacks in patients presenting with heart attack, and then give the blood clots to this laboratory team and analyze it. And it turned out that in about 101 patients, I believe, that 80% of those blood clots had pathogens characteristic of periodontal pathogens, of root canal infection-associated pathogens, and another 30% from the gums.
That is incredible.
But here was the kicker. The blood clot had 16-fold, that's 1,600% greater concentration of pathogens in the surrounding blood. That is cause and effect. You didn't have a blood clot suddenly spontaneously form and then magically pathogens concentrated inside it. The blood clot formed because of the pathogens. And amazingly enough, this was published in the main subspecialty journal of cardiology, Circulation. Yet to my knowledge, 2013, now 5 years later, 2018, I don't think cardiologists are routinely looking at the mouths of their patients, which is not only something they should do, it should be number one on their list.
I agree with you fully. Let's explore this a little bit further after we come right back. We're here with Dr. Levy. So, Dr. Levy, you were talking about infections, chronic infections actually being the cause of atherosclerosis and also blood clots causing stroke.
Yes, sir. And we also have evidence that this occurs quite frequently, not as frequently as in the heart, but also very frequently inside the cerebral blood vessels, causing stroke. This was also examined by this same group of Finland researchers, and they found a very high concentration and high percentage of the time presence of these same oral infection-related pathogens and toxins inside some of the aneurysms that were involved in different people's strokes. So it's not just something associated with the heart. It's just that the situation with the heart at this point in time is most clearly and scientifically documented, but it's not hard to see when you look at the literature, and this is all covered very extensively in the book, when you look at the literature and see that, and this may sound like an exaggeration, but when you see nearly every significant known chronic disease has a strong connection with oral pathogens. They've initially just looked at the association between gum pathogens, gum disease, and these different diseases. But we're now seeing, and this is the point the book makes, is that when you have an infected tooth, it has an even higher concentration and is a greater source of the pathogens and toxins in infected gums. So even though the studies weren't specifically done yet looking at those teeth in diseases throughout the body, it's clear that the association and, dare I say, cause and effect is even more prominent for these infected teeth than for the infected gums.
So I'm just curious, it might be interesting for listeners also to understand, how can, when a tooth is infected, you're thinking that, that infection is just localized right by the tooth. How can that then move from the tooth and then impact your blood vessels or impact any other part of the body?
Well, that's interesting because the infections that we're talking about are actually at the tips of the roots of the teeth. So they're in the gum, deep in the gum, at the tip of the tooth, and then they form enough infection that they form a hollowed out area that you see on X-ray. Well, there's something else. It's directly adjacent to and often directly, intimately inside of the involved venous blood supply and the lymphatic blood supply. So what happens is every time you chew on an infected tooth like this, especially in the back of the jaw where you generate enormous pressures, and most commonly it is the molars that have these infections, is you generate enormous pressure and you literally squeeze these pathogens and their toxins directly into the draining venous system and directly into the draining lymphatic system. Now, in the case of the venous system, why don't you have problems in the veins? Well, there are other physical factors that determine where remote infection sets up. And one of that is pressure. So when you squeeze this into the veins are a low-pressure system. Nothing is embedding those pathogens into the vessels. So it goes through the veins, into the pulmonary circulation, comes around into the left atrium, still low pressure, into the left ventricle, and then the first squeeze of the left ventricle, you go from 4 to 5 millimeters of mercury to 120, 130, 140, 150, and the coronary artery that receives almost 25% of the blood supply gets the lion's share of these pathogens coming directly into them with high systolic pressures, embedding them into the walls. So that's why the coronary arteries, even though they're so remote from the mouth, get the lion's share of these pathogens and toxins. And the lymphatic system, similarly, the teeth share lymphatics with the breast. And you can see this on thermography very readily. When there's an infected tooth, there's an increased heat, and you can literally see, in many cases, not 100%, you can see the red connection between the tooth going down into the breast. And we also have evidence that shows that lumps in the breast and breast cancers have also inside them periodontal pathogens. So the case is not as strong for the breast as for the heart in terms of published literature, but I think the connection and the cause and effect is equal for both heart disease and breast cancer.
So for women that wants to protect themselves from breast cancer, or if they are struggling with breast cancer, they've been diagnosed, they're dealing with fibroids or whatever it may be, they should immediately look at any kind of dental infections, obviously, to minimize the impact on the breast. That seems to sum it up.
Yes, sir. That's correct. And an important point I would add here is the compilation of this information is still fairly new, and it's not common knowledge amongst radiologists and the dentist and the internist and the cardiologist. So it's also important when you see this information and you decide that you want to get the 3D X-ray, is that you make it clear when you're getting the X-ray that you're looking for infections in the teeth. I say this because the test has an enormous amount of information. And if you don't direct the interpreter of the test as to what you're looking for, you'll oftentimes miss it. I mean, this thing looks at so much different pathology in the head and not just the teeth that you need to direct the interpreter. I mean, for example, as a cardiologist, when I read an echocardiogram, I can read an echocardiogram without any information, go through it systematically, look at everything, but I still won't give the same level of information as if the patient or the doctor says, specifically look at the mitral valve leaflets for endocarditis. Then I can focus in on them and I can say, no, the leaflets look perfectly clean, or maybe there's a suspicious spot. So what you're looking for in the examination does significantly impact the interpretation. So if you're going to go to the trouble of getting a 3D x-ray, make sure that it's being done because you're looking for infections. Yeah. People say, well, where do I get this? Well, virtually all implant dentists have it. They have this Clear Choice commercial on TV now. It's very interesting. You could have knocked me over with a feather. They have on one of the commercials. They have this guy come on and say, "Well, I talked to my cardiologist, and he says we can't do anything for you until you take care of your teeth, because the teeth are the root of all heart problems." I said, "Oh my God, the word is getting out." But the point being is, implant dentists all have this machine. Many endodontists, the root canal specialists, have this machine, and the larger dental practices have this machine. So it's not rare. You just have to do a little looking, and it should come in as about a $300 test. And usually when you go to the Clear Choice or the implant doctors, a lot of times it's part of the package of just getting an evaluation.
Wonderful. Well, I'd like to, when we come right back, I want to chat a little bit more how an infection can actually drive cells to become abnormal and become cancerous. We're here with Dr. Levy. So Dr. Levy, we're talking about infections and also how they can then impact the body. Infections actually stemming from the teeth, how they can drive processes even like cancer. Can you tell us a little bit more about that?
Yes, well, it comes from the fact that my research has led me to the conclusion that all disease is increased oxidative stress, not oxidative stress causing it, but the fact that biomolecules get oxidized, lose electrons. When they become oxidized, they lose function. And when they lose function, it doesn't work. Biochemical pathways get slowed down and diseases start. So the whole point being is everything should be focused on either preventing oxidative stress, number one, and repairing the damage that oxidative stress has already done. And this is done by antioxidants, which come in and reduce the biomolecules. They regain their function. You lose the symptoms. But the big thing that doesn't get addressed almost at all, and it's perhaps the most important part, is the fact that toxins, we hear a lot about toxins these days. Well, why are toxins bad? Toxins are bad because all of them ultimately cause biomolecules to be oxidized. That's why they're toxic. And different toxins go to different places and different concentrations, but the final common denominator is toxins increase oxidative stress. Then when you take from that, well, where do toxins come from? Well, we know it comes from many places, but inside the patient's body, the vast majority of the time, the worst and highest concentrations of toxins come from infections. And the worst infections in everybody ends up being in the mouth. Now, you could have an infection in your intestine or something like that, and that would be bad. But for the person that's listening right now, 95% of the time, your bad infections are in your mouth. So that's why these considerations are so important. You need to, number one, resolve infections and stop bringing new oxidating toxins into the body. And then number two, you need to have a protocol that helps repair the damage that the toxins have already done. And
these, what people have a hard time sometimes to grasp, it's not always the infection, the pathogen in itself, it's the impact of the pathogen or the the chemicals, the neurotoxins that they secrete that becomes the issue, and then the immune system, how they respond to that. I mean, I usually tell people that a pathogen, they got to eat and they got to poop, and it's that poop, that is so toxic and creating them that oxidative stress.
Well, that's absolutely correct. I mean, all pathogens have their own metabolism. And that metabolism, as they grow and they proliferate, all produces oxidized metabolic byproducts. So anything that's oxidized doesn't have enough electrons in it, and it ultimately is toxic because it's looking to take electrons away from healthy biomolecules. So with pathogens, you have endotoxins, you have exotoxins. Pathogens also accumulate iron, which is the most pro-oxidant substance in the body. We need iron to live, but above a very minimal level, enough to make a normal amount of blood cells, iron is highly toxic. Same thing with cancer cells. When cancer cells die, they release large amounts of iron. So, yes, and the point that you made is that pathogens produce a lot of toxins. And so as long as these infections remain unaddressed, you have a nonstop, ongoing source of toxins that literally disseminate throughout your body. And we have blood tests called the CRP, C-reactive protein, that reflect the level of inflammation, which is the same thing as oxidative stress in your body. And the higher that level gets, the shorter your lifespan is. That's simple. High CRP means decreased all-cause mortality. Increased all-cause mortality. Increased chance of death from all diseases.
And what should be a good level of CRP? I mean, what are... I know we have the standard measurements, but for optimum health, what will be a good range?
That's a very good question. The supposed reference range, which often gets misinterpreted as the normal range, the reference range just means statistically what most people have. The reference range is 0 to 3. Well, I can tell you right now that most people have diseases. Most people have increased inflammation. So that reference range does not represent the target of normal. In fact, normal is 0.5, 0.4, 0.3 or less. Having one between 1 and 2 is not bad, but by the time you're up to a 3, you already have a significant statistical chance of increased heart attack possibility.
So that not only then heart attack, but also even your risk for cancer is increased dramatically if your CRP is elevated.
That's correct. And if you do CRPs routinely, when you have your very diseased patients come in that have advanced cancers, many of them have astronomical CRPs. They have 20s and 30s and 40s and 50s, and so you know that the body is fighting an enormous amount of oxidative stress in these type of diseases.
So for a person wanting to prevent disease, I mean, usually they go and they get their labs done, and they get they get their lipid panels, which includes cholesterol and high density, low density. And then they do maybe a comprehensive metabolic panel and a CBC. But if they don't do things like C-reactive protein and also check for the infections in the teeth, they really are walking around blindly, not knowing what's going on.
Very, very much so. I mean, if you have a severely abnormal CRP, it's unlikely that your lipid panel is going to be completely normal, but it's still the most specific test for looking at the status of oxidation and oxidative stress in your body. So it is extremely important. One thing that's also very important, critical even, is these things and even the infections should not be addressed in isolation. Everybody, and this is a big point in the book, really, I don't care how old you are. If you're very old, but you want to live longer, you need to have a balance of your sex hormones and your thyroid hormones. Both of these things, when they get below normal or even pretty low in the normal range, they promote or they permit the presence of increased oxidative stress in the body. And in the case especially of the thyroid hormone, when your thyroid is even slightly low, infections are much more likely to metastasize, whereas when your thyroid hormone is normal, these infections tend to stay put. So the best thing with an infection is to get rid of it, or in the case of a tooth, to take it out. But there are a lot of people out there that live a long time that have infected teeth, and this is because their hormones are perfectly balanced. So this is a very critical part of the overall picture of patient management in dealing with infected teeth and other infections in the oral cavity.
In your book, you were mentioning a study about there's a group of individuals that were given desiccated thyroid supplement, and the difference between them versus the rest of the public.
Yes, and that's, I'm glad you pointed that out, because when I first ran across that data, it just knocked me for a loop. The point being is, nearly everybody, like I said, that has a heart attack, for example, has some dental infections, whether they're root canals or other teeth. On the other hand, there are many people that have infected teeth that don't get heart attacks. And this is what Dr. Broda Barnes looked at probably some 40 years ago, is he treated low thyroid, hypothyroidism, in very much of a clinical fashion. He didn't rely just on blood tests. And he found when they regulated the patients well, over a 20-year period, looking at roughly 1,500 older people being treated for their thyroid, 4 of those people over a 20-year period had heart attacks. That's next to nothing for a group that size at a period that long. If you look at the Framingham study, 75 or 80 people statistically should have had heart attacks at that time. Yet, we know that those are regular people, so they have the same incidence of root canals and dental infections as the rest of the population, but they didn't get heart attacks. And, of course, the common thread there is they had completely normal thyroid function. He also, Dr. Barnes, had a whole bunch of people drop out of the study, stop taking the thyroid hormone, and a large percentage of them had heart attacks. So that's indicating the thyroid function is extremely critical in your susceptibility to infection and oxidative stress.
That's fascinating. Yeah, when we come back, I want to chat a little bit more about root canals. I mean, that's something that's so common and most people have. We'll be right back with Dr. Levy. Welcome back. I'm here with Dr. Levy. Dr. Levy, we've been talking about infections, and how about root canals? There are so many of us that are that have root canals, need root canals. What kind of impact do they have on our health?
Well, root canals statistically are arguably the greatest cause of heart attacks and breast cancer because 100% of them are infected. This is covered in great detail in the book I wrote with Dr. Robert Kulotz called The Toxic Tooth. Now, as we mentioned earlier, not all root canals cause heart attacks because in some patients, the infection stays put. The only problem is trying to determine ahead of time in which patients is the infection going to stay put and in which case is the infection going to disseminate. And that depends on a lot of factors, evidence of your CRP, how high it is, the balance of your sex and thyroid hormones, your basic immunocompetence, how strong your immune system is. But bottom line is, if there's any alternative available, you really don't ever want to get a root canal because it assures that the tooth is going to be infected and will stay infected for as long as it's in your mouth. Now, having said that, there's an issue that's covered in the book, Hidden Epidemic, that I feel compelled to add to, which is we also know that studies have been done that look at the untreated but asymptomatic infected tooth that I've talked about, and the root canal treated teeth. And when those two teeth are compared with each other, the untreated infected tooth is substantially more toxic than the root canal. So this means that when you see an infected tooth and you offer the patient, well, the best thing for you to do is extract it, and they say, well, it doesn't hurt me. I don't want it extracted. Do whatever else you want to do, doctor, to make me healthy, but leave the tooth alone. Well, when the patient takes away the option of extraction, then getting a root canal by a high-volume, very experienced endodontist, not just a regular dentist, is a reasonable option because we have the statistic to show that the root canal is less toxic than the untreated infected tooth that you discovered on 3D X-ray. But bottom line is, when the patient says, do what's best for my health, these teeth should come out, the socket should be cleaned up well, vitamin C, sometimes antibiotics, and ozone should be given to assure good, solid healing of the socket. And oftentimes, if the patient is so inclined and can afford it, you can proceed with a good implant, because most of the time, nothing's 100%, but most of the time, the implant represents a good long-term solution to a lost tooth.
So that is actually a much better option instead of having a root canal that can then continue feed infection into the system, impacting the immune system and creating oxidative stress, is then to have an implant.
Absolutely. That would be my recommendation every time. But of course, like I said, there's people that don't like dentistry. There's people that can't afford implants. There's always different factors. But if the patient says, take me in the direction that's best for me and my long-term health, it would be extraction followed by an implant, yes.
And you mentioned, I know that this is a huge subject and we can talk hours about it. You mentioned then getting vitamin C along with then the extraction or getting the root canal. Why vitamin C?
Vitamin C is truly nature's antibiotic. Everything about vitamin C, and it's in the literature, although not widely recognized at all in mainstream medicine, vitamin C virtually resolves nearly all acute viral infections and most acute bacterial infections, and is very powerful in stimulating the immune system in at least 20 different ways. So even when you're not attacking the pathogen directly, the fact that you're strengthening the immune system, matter of fact, it's the concentration of vitamin C inside the immune cells that gives you the most immune strength. Macrophages, which are the scavengers of the body to go after pathogens, have 80-fold, 8,000% more vitamin C inside them than the surrounding plasma. So vitamin C is literally the fuel on which the immune system runs and deals with infections of all variety.
And with vitamin C, I mean, is it enough then just to take your 1,000 milligrams a day orally, or what should be done? What should a patient do in regards to that if they're dealing with an infection?
Well, everybody's immune status and antioxidant status is different, but when you're dealing with an infection, you take as much vitamin C as you can, as you want to feel better and resolve the infection. It's a little different when you're dealing with a chronic disease. Most people, if they take vitamin C long enough, they find out that a certain amount of vitamin C, 5, 10, 15, 20 grams, or liposome encapsulated, or have intravenous available. They take what they take in order to feel better. And if they're following their disease process with their physician, they also take vitamin C to the point that they can see abnormal blood work improving or normalizing. Those are your goals. There's just no way to say everybody should take 1, 3, 5, 7, 10 grams of vitamin C a day, because everybody's pro-oxidant toxic status from infections and other sources is different.
Yeah, and with vitamin C, in your book, Curing the Incurables, I remember reading the point that if you deal with certain viral infections, you actually need up to like 200 grams of vitamin C, to deal with that infection. That was just astounding to me.
That's true. That came from the work of Dr. Robert Cathcart, who very nicely put together his experience with many thousands of patients and showed that while some conditions could be stabilized and resolved with 10 grams of vitamin C a day, as you said, some viral infections. Good example is Ebola and some of these other what's called acute hemorrhagic viral infections. They're hemorrhagic because they just about destroy or metabolize every vitamin C molecule in the body. And if you want to get on top of them, you have to not just take enough vitamin C to fight the infection, you also have to take enough vitamin C to restore the extreme deficits that the virus has already caused. And this is really why these viruses are so deadly, is because they induce an acute scurvy. And especially in Africa, where the population is so malnourished, it's much easier for a virus just to tear through that population and kill a large number of people than it would be to tear through the United States and kill a lot of people who, relative to Africa, are extremely well fed and have a much better nutrition status.
I thank you so much for this, for chatting with me today, Dr. Levy. I want all listeners to check out his new book, Hidden Epidemic, available on his website, peakenergy.com. It is truly an eye-opener exploring the connection between periodontal disease and diseases such as heart disease, diabetes, and even cancer. That is all for today. I'm Dr. Michael Karlfeldt with HealthMade Radio. Health is what you make it.